All right. It is now 12:01. We're going to go ahead and get started. Welcome everyone to the CCADP, which is the Children's Community Alternative Disability Program. Here, my name is Jennifer Aaron. I will be the facilitator today. We have with us.
You have not entered any numbers. Please re-enter your meeting ID followed by pound.
We do ask, before I introduce our presenter today, to please mute your computer from any background noise so we can, if you don't mind, get the information that is being presented today from our presenter. Um, our presenter today is Christina O'Connor. She is with Delaware Medicaid, Medicare Administrative. She is a training manager there. She's been there for quite a while. She's very versed in the CCADP program and many other things with Medicaid. We would like to welcome today here with us, Christina O'Connor. Thank you, Christina. Welcome.
Thank you, Jennifer. And I heard we have a huge group, so that's awesome. We're always happy to come out and share information about our programs at Medicaid and Medical Assistance. Our division is a little different. Our sister agency is Division of Social Services, and they have kind of the regular Medicaid and other programs there. Our division really focuses on vulnerable populations in Delaware. So typically our populations are elderly and or disabled populations. And so our programs tend to differ a little bit. Also on the line with us is Holly Reynolds. She manages CCADP for us, and so in one of our areas. And so she'll be available too to help me with questions, because I am a couple years removed from the field, so I'm not always on top of, changes and different processing standards and stuff as they change in the field anymore. So she was able to join us today. So I just want to let you guys know she'll be hopping on and answering questions as well at the end. If you prefer to ask your questions as we go along, that's fine. I don't have any issues with that. And if someone wants to watch the chat, or if you just want to unmute, we're very informal, so we just like to get information out, and however it's going to be best for you, we're fine with that. For our agenda, we're just going to go over the introduction for CCADP in case someone on the call has never heard of it or don't know what it is. We just want to introduce you to the program. We're going to talk about the eligibility for the program, the application process, managed care enrollment and how that piece of it works, and then the approval duration and review. I know that was a question Jennifer said that was coming up just in other panels, so we are going to be going over that as well. And Jennifer, if you want to go ahead and move to the next slide. Jennifer is going to kind of be my navigation today on Zoom, so I appreciate you, Jennifer, for stepping in and helping out. Also, I always like to say, if anyone needs a copy of this information, we can get that to you. Just if it's a little bit before you're going to use the information, check back and make sure nothing's changed, only because with federal programs and different things, we're always getting communications down and having to tweak different things. So we just want to make sure the correct and current information is out there. But I have no problem sharing this with anyone. You can reach out to Jennifer, or Jennifer, you have it, you can, send it out as needed. I always like to caveat the information we're sharing today is current, but make sure that, if it's a little while since you've seen it, you touch base with me and make sure that it's still current. So the introduction, Children's Community Alternative Disability Program, it's a mouthful. So usually you hear people refer to it as CCADP or Disabled Children's Program, because that used to be the name of the program and they changed it. So, CCADP, Disabled Children's Program, Children's Community Alternative Disability Program, usually all one and the same. CCADP, it's a Delaware Medicaid option, and it's designed to serve children who have significant disabilities. They might otherwise qualify for nursing care in the home or possible institutional setting. So we just want the program to serve as many children as possible at home or in a non-institutional setting. So if they're having to go somewhere for treatment or, you know, have lengthy stays places, we just want to make sure that they're able to have the medical coverage for those situations. And one of the things that we try to ensure is that it's done safely, efficiently, and economically to the best of our abilities. Any child whose disability profile meets the designated level of care could be eligible for Medicaid. And we don't look at, for this program, and this is how it differs from other Medicaid programs for children, we do not look at the parent's income, resources, and they're allowed to have other primary insurance. So we're only looking at the child's income and resources for the program at application. And, you know, they can have mom and dad both working. Mom and dad can have 401ks. Mom and dad can have private insurance through their employers, and that's fine. We're just going to be looking at the child when we go through the application. So that is how this program differs a little bit from other Medicaid programs. So when we start talking about eligibility, I know everyone hears Medicaid, and especially whenever we get into specialized programs in Medicaid, people tend to get a little nervous or frustrated is probably the word I hear most. And so hopefully some of the information in this presentation is going to clarify and help make those situations a little less frustrating. So Medicaid eligibility is available to children who meet all 7 criteria. And those criteria are set by the federal government. They put out regulations and policies we have to follow. And just like everyone else, they will come in and monitor kind of what we're doing, how we're approving things. So we do get quality control comes in, you know, and monitors how we're processing and, you know, making sure that we're doing things right. So that's why it's really important as staff at DMMA that we're processing everything according to the federal regulations. So the children have to meet all 7 criteria. They have to be between the ages under the age of 18. So as young as they need to apply, and then as long as they apply before the age of 18. At age 19, they will start to transition out of Ccadp. So between the year 18 and 19, we don't just at 18 shut off the Medicaid. Between 18 and 19, we're kind of transitioning them into either other programs of Medicaid, or we're having those conversations if they're young adults and they're applying for SSI, or maybe they're, you know, are able to go to a, you know, pathways to employment or something like that. We're going to be working with the families at that point to figure out which Medicaid program is going to be best for them, to continue to support them and help them get their best quality of life at that point. But age 19 is when this program will end for them. The child's countable resources cannot exceed $2,000. I know that doesn't sound like a lot of money, but that's the federal limit. Social Security Administration sets that, and that's kind of what we follow as a standard. So that's what it is for a single individual, is $2,000. The child's countable income does not exceed 250% of the SSI benefit level. What does that mean? So currently right now for a household size of 1, which we would just be looking at the child, so it would be a household size of 1, it would be $2,358, and that's gross income. That changes every year when the federal government puts out cost of living adjustments, but currently it's $2,358 for the household of 1. And again, we're not looking at the parent's income or resources, we're just looking at what the child has.
And I believe there's a question in the chat, Christina, and the question is, does this Medicaid cover a significant disabled individual to work, independence, like supported employment?
So for disabled children, it would depend on what job they were looking for. Typically, they're not looking for employment until they reach 18 or 19. So depending on the disability, we have other programs that they would cascade into, and those programs would have that availability. Some of the programs are lifespan waiver or our HCBS. Also, if someone is eligible for SSI, they could be open in one of our home and community-based services programs that does allow for pathways to employment and supported employment services. Does that answer the question?
I believe that was from Ms. Mitchell. Did that answer your question, Ms. Mitchell?
Yes, it did answer the question in totality. I would just ask, could we have the resources of those Medicaids just to share with families? Because i.e. working with the Project Search program, significant individuals kind of transitioning out into employment. And of course, they're usually either exceed 18, as you said, 19, 21.
Yeah.
But they don't have the funding to continue to support them, such as job coaching and things like that, to continue to help them to become independent.
Yes, and I just talked with Jennifer before we started the presentation about also coming back and doing a presentation on those home and community-based services programs. So that's probably going to be a little helpful too. But if you can put your information, Ms. Mitchell, in the chat, I can send you some stuff before then. Yeah, thank you for the question.
Great,
Thanks,
thank you.
Jennifer.
Absolutely.
So the fourth,
Christina, this is Holly.
did
Can I
someone
jump
have a
in real quick?
question?
Yes, Holly, can you hear me?
Yes, hey.
Just another program that might be for the children that are aging out of this, depending on if they're working and they're disabled, would be the Medicaid for workers with disabilities. That may also be an option.
Okay, I'm gonna jot that down, Holly. Thank you for that reminder, and I will make sure I send that information as well.
Okay, thank you.
Thank you.
Thanks, Holly. And you said that's for Medicaid for workers?
So we have a
With
program
disabilities.
called Medicaid for Workers with Disabilities. And so that program is being looked at a lot right now because it does not have a resource limit. And so for someone who's working and receiving wages, we could possibly open them in that program as long as, you know, they have their disability is going to continue.
And I handle
Christina,
that program as well.
okay.
Yeah, Holly is also manages that program.
And would that be, and that would start at 19, correct? Or is that 18? Or maybe 16?
It actually
So
can start at 16.
16, yeah.
That's great, Holly. Could you send me, I put my email, and the reason why I'm asking is because this year with DVR, that's where I work, the Division of Vocational Rehabilitation, we will be paying interns a wage within working in the hospital setting, which may then help them get an earlier start so they don't have a breach in service down the line in the case of retention or maintaining employment. So that's great to know. Thank you so much.
You're welcome.
yes, thank you, Holly. I'm glad you're on the call. So the child's profile is consistent with the level of care of a hospital, skilled nursing facility, intermediate care facility for mental retardation, it's MR, or intermediate care facility institution for mental disease. And these are the different levels of care that they're looking at when we receive the medical packet and it goes to a medical review team. So they're looking for a level of care that would meet one of these. The child would need to meet one of these levels of care in order to be medically eligible. Our eligibility is two parts. So we have the financial eligibility we just looked at, and then the medical eligibility piece as well. So they would have to be financially and medically eligible for this program. Did you have anything to add about the level of care, Holly? Because that's the piece I don't know a whole lot about.
Actually, no, only because, you know, obviously the medical review team is the one that handles that part. So I forward all the information to them. I do know some parents are concerned, saying, does that mean my child needs to be in an institution? And it does not mean that. It's just referring to the care that's needed.
Okay. Thank you. Yes, and that's a good point. This is kind of how we look at the level of care that's needed for a disability. It doesn't mean that they have to go into a facility or that they have to receive these specific services. It just means that this is kind of how we monitor our level of care to make sure someone is eligible. And then the child must meet the SSI medical disability standards. So if it's a chronic condition for, one of the things we just talked about, but what happens is when we get the application and the medical packet back, we're, like Holly just said, we're sending that to the medical piece to a medical review team, who are doctors, and we'll be reviewing it and kind of determining. So even if a child is not receiving SSI income, that's fine. As long as their disability would meet the SSI standard, we would be fine with moving forward and approving them medically for this program. So I hope that makes sense. They don't have to be receiving SSI income. I don't want that to confuse anyone. They just have to be, their medical level of care has to meet one of the SSI medical disability standards. And then number 6, the comparable level of care in an alternative setting. So the example would be the child is still able to stay at home, to live in the natural family home or to live in the community, and does not need like around the clock medical or hospital care. So as long as that is appropriate and there's, they're able to stay in the community, then they would be eligible for this program. And then the estimated Medicaid cost of care in an alternative setting is no higher than the estimated cost of comparable facility-based level of care. What does that mean? Economically speaking, because we want to use our Medicaid dollars from the federal government in the best way possible, so we're reaching as many people as possible. So if the Medicaid cost is going to be less than them living in a facility, then they would be fine with continuing with this program. If it appeared that the cost for them to receive, someone coming in and out of the home or respite care for this program is going to be more than around the clock facility care, then that would kind of prohibit them from this. I don't know that we've ever had, I know when I processed the program, I never had anyone denied for that reason. Typically, it is much more economically sound for people to stay at home, and we want that. We want to keep families together. We want children to stay in the community, like Ms. Mitchell was just talking about, if there's a way to get them into pathways to employment. We want to make sure that we're able to keep them in the community as long as possible, but that is a check, and that's, again, one of the standards from the federal regulations. So application processes, we have 3 Division of Medicaid and Medical Assistance sites that process these Ccadp applications. We have 1 in each county. Sussex County is at the Thurman Adams State Service Center, and that's in Georgetown. Kent County is our Milford State Service Center. That's where Holly is from. And so Milford State Service Center at Riverwalk. I always like to clarify that because in Milford, we have 2 centers, so Riverwalk, and then we have Milford Annex. So Milford Riverwalk is where the applications for this program are processed. And then in Newcastle County, at our Rob Scott building. And they're on the 3rd floor because that building is large, many floors and many different offices in that building. It's easy to get lost. So in Newcastle at the Rob Scott building, it's on the 3rd floor. And so if you ever need to, inquire or go in, drop off paperwork applications, this is where they're located. I like to give the locations of where the staff are, but then also say that you can go into any DMMA site and have information forwarded. So one of the things where the application could be emailed to. So Holly, do you guys have just a resource mailbox or?
We do, but usually I think the workers can just have it emailed directly to them.
Okay, so I will drop in the chat later the. Do you think it would be easier, Holly, if I put in the information for each staff member, or do you think email addresses, do you think that would be okay
Yeah.
with Robin? Okay, I wasn't sure if everybody was okay with me just dropping in their personal emails. So based on the county would be based on, you know, whichever county the application is for would be the person that you contact. So in Kent County, it would be Holly Reynolds. In Sussex County, it would be Robin Scarborough. And then Newcastle County, is it still Kenya?
Kenya
Yes.
Stone, yes.
Yes. So I can drop all their email addresses in the chat and that way you'll
And
be able to.
and I also too, Christina, have been working with families. So if they
Okay.
want to send me the I've been sending out applications, but if they want to send me the application, I usually am sending it also to
Okay,
those 3
perfect.
county contact people.
Okay, great. Thank you,
Mm,
Jennifer.
absolutely.
So the application process, you can apply online. And so, you know, you can always go online and apply for any program. I will say, if you apply online, especially for this program, because there's medical paperwork that has to be completed, you will have to get things mailed out to you and then send it back. So it's probably easier if you request a packet or go to an office and get a packet and then return it all at once. As opposed to going online and then having the application assigned and then starting that process of getting things mailed out. So we're always happy to send those things to you electronically. If you're trying to apply that way, we can make sure you get that paperwork, but you can also apply online. It just may take a little bit extra time. The applications can be dropped off, mailed, faxed, or submitted online. There's 4 forms that must be completed along with the application. Those 4 forms is one of the pieces that's missing from the online application. So I just want to, I always like to say that so that someone doesn't complete an application and then wonder why they're getting stuff mailed to them. The forms are, and we're going to go over these, but the attending physician certification and the comprehensive medical report, they have to be completed all the way through in the entirety. A physician has to sign off on it. And even if some of the questions don't apply, those questions, you have to put something in the answer. You have to say NA or does not apply or something so that we know you've seen it and you've answered it. Sometimes we get the forms back and half of them, you know, some of the questions don't apply, so they just don't answer it and there's nothing on the line, and that holds it up because we can't submit it unless everything is addressed on that form. The caregiver parent must complete the primary caregiver assessment and the authorization to disclose information forms. And again, those are in the entirety, and that's just so when we send the medical packet up, we want it to be complete so it doesn't hold them up making a decision. So if we have everything on our end done in entirety and they don't have to question anything and they can review it, then you're going to get it. It's going to kind of speed up that process. All questions, all forms are answered. If something does not apply, NA is fine. And then you want to make sure that the physician is signing and dating the forms. The medical review team will not accept forms that are incomplete. Once the application and all the forms and any requested verifications are received, the worker determines financial eligibility. So that would be Holly, Kenya, and Robin do the financial eligibility for this program. And then they send all the medical forms to our medical review team to determine if we can approve the level of care. And then both pieces have to be approved, financial and medical.
I have a question, Christina.
Sure.
What does the medical team consist of? Just in case people answer further down the road.
Holly, would you like to, do you know?
I know there's a doctor and I believe several nurses and a social worker.
So we have a doctor
That's
who,
not the title now.
yeah, we have a doctor who is like he reviews all of our level of cares for all the programs that we administer, just to make sure he kind of oversees the whole medical piece for DMMA. I'm sorry, we just had someone new step into the role. And then there's several nurses, as Holly said, and a social worker, but I don't know how many, if that's what you're asking of, but it's comprised of a doctor, nurses, and then a social worker. And that's who reviews the medical piece packet.
Okay, thank you.
Absolutely. Sorry, that piece isn't something I've ever been a part of, so I can't speak a lot on, what they do when they get it all, or who, like if they're all just sitting, or it goes to, like it might go to one of the nurses first, and then she sends it to the doctor for final approval. I don't know what the process on that side looks like.
Okay,
Yeah.
that's fine. Thank you.
You're
Just in case
welcome.
the families are just curious to
Yeah,
know who's actually
absolutely.
looking at their documentation, the medical,
Yeah.
because
Yeah.
that is their personal information, even though they're applying, just to give them an idea. who's
Absolutely. And it
looking at
is,
that.
I mean, they're all licensed and, with the correct credentials and all those things. So the RNs that work, or the nurses on staff at DMMA who process and approve level of cares are regular licensed nurses. So, they've been through all the school, they've been through all the training. And so they're just working with our division with the level of care.
Awesome. Thank you.
You're welcome. So individuals who are found eligible must enroll with a managed care organization. And then the way that happens is through a health benefits manager. It's a lot of pieces, we know, but how it works for the families is once someone is approved, they get that letter and the information for a health benefits manager. When they call the health benefits manager, they'll walk them through how to enroll with the managed care and kind of can answer questions about the managed care. One of the things I always say first is if they have specialists or, specific doctors, they want to make sure that whatever managed care they choose or they select is accepted by those specialists, because the last thing we would want is for them to select one and then find out that a cardiologist, doesn't accept that one. And typically with Ccadp, we don't see a lot of that. But I always just like to put it out there because things change in physicians' offices and specialists' offices all the time. So we just would, check with any specialist ahead of time, the family should, to see if there's one that, they prefer or that they accept over another one. We do have 3 managed cares in Delaware right now. So then they would enroll with a managed care, and then their benefit package would look just like one of our benefit packages, like a private insurance.
And can you just tell the families that are not familiar, Christina, the 3 MCOs in Delaware?
Sure. We have Highmark. We have Emeritus Cardis or AmeriHealth Cardis and Delaware First State. Yeah, so we have 3 that you can choose, that they can select from. And Centene or Delaware First Health, they just came on board about 1.5 years ago, so they're newer. AmeriHealth Cardis has been here for several years, and then Highmark has been here for as long as I've been here. So those are the 3 that they can choose from.
Thank you.
You're welcome. Approval, duration, and review. The approval of an initial application generally effective for a period not to exceed 1 year. We do redeterminations for this program, so typically 1 year. Per our policy, so to speak, it's 6-month guaranteed eligibility, but we're not usually looking at it unless, a parent is coming to us with information or, something like that, a change occurs on the side of the family. We're not going to review it for at least 1 year. And then the initial approval could be for a shorter period if like a medical determination is only good for 6 months. It's the child has something that they're going to be out of and no longer need services after 6 months. We could just get a level of care for a specific time period. The redetermination of eligibility is expected to occur annually. It may otherwise be prompted by a notice, again, if we are told that something has changed financially or medically for the member. And then it includes a reassessment just to make sure the child's still meeting all 7 eligibility criteria. And then if a child manifests a chronic profile, our division may utilize abbreviated reassessment forms. So if it is, and Holly, hop in here if you'd like, because you're doing this currently. I'm a little bit away from it. It's been a while. But if it's something where it's going to be an ongoing chronic disability, we can maybe do like a shorter redetermination and not need to redo the whole thing. And that would be based on the medical level of care that was given in the beginning at application.
Yes, that's correct. So the financial is done every year. The medical is a case by case. I have some that are due yearly, some that are 2 years, some that are 3 years, some that are 5, and then I have some that are until they age out.
Yeah.
So it all depends on the child's diagnosis.
Yeah. Thank you. I'm never sure with those little pieces of processing what has changed since I last processed. So the forms. Some of the forms, when we send a packet, I think sometimes it can be intimidating for families because there's so many forms. And we know it's tedious, but really the more information we gather up front, and well, we have to for the medical piece, but the more information we gather up front, the easier it's going to be like throughout the process. We're not going to have to go back and forth a lot of different times. And for families, especially who have disabled children and maybe have additional children at home, it's a lot, it's a lot, and we recognize that. So we try to make it as easy as possible, and helping them get a complete packet in the beginning. So the forms that we're going to review are the attending physician certification, the comprehensive medical report, primary caregivers assessment, and the authorization to disclose. So the attending physician certification, this is just assigned, this is the one that's assigned by the attending physician you see at the bottom, and they're just certifying that the medical care received by the above named child better than or equal to or not as good as the care that a child would receive in an institutional setting, and that the care is appropriate, is not appropriate. So the doctor is going to be the one, or the physician is going to be the one who's signing off on, is the child, okay at home? Is it an appropriate setting for whatever the child needs? And if the doctor, he or she signs off on this, then that's how we're going to meet that one criteria that we saw, the number 7, that federal regulation. This form is what kind of allows us to move forward. The comprehensive medical report, this form is the one families are like, what in the world? So there's different pieces, and it tells you on each one, on each section, kind of what needs to be completed. And it just says to the physician. So the physician is going to fill these things out. A lot of times it'll be a nurse or someone else that will complete this in the medical practice, and then the doctor reviews it and signs off on it. So this is the piece that we just need to make sure every single question either is completed or has an NA. And then this is the primary caregivers assessment, and this is going to be it goes through the instructions. The form should be completed, submitted with the application. Please complete all questions. So there's a lot of different things on here. And it really talks about whoever is giving the care for the child in the community should be completing this form. And then authorization to disclose. A lot of people have questions about this form when we ask for it, because they think we can just take it and go get, all their personal information, and we can't. So that's one of the misconceptions about this form. Basically, this is for if the medical review team were to have a question, so they are reviewing the comprehensive medical report and there's a question about something that, you know, the physician listed, or something comes up and there's something additional that they need for the approval, they can just go right to the physician and ask for it. If we have this form, if we don't have the form, then they have to go back to the parent, who then has to go to the physician's office and try to get it. So really this form is just so we can try to help, you know, collect documents if needed after the whole packet has been received. So that's why we ask for this. And then for financial records, things like, I know for one of the things we use it for on the long-term care side, which is with the elderly and or disabled populations that are still living in the community. A lot of times they can't drive or get out, you know, to a bank or to a financial institution. And this just allows us to request on their behalf something that we need, or like income or a pension letter from the state of Delaware office. So it's really just so we can try to help get information so the family isn't running around getting it if there's anything additional we need. So that's why we ask for this form. So that is, and I know it's usually only about 40 minutes. We wanted to make sure we had enough time for questions. And I do have a Ccadp kind of a flyer. It's in color. We take it to events and community things that we do. I will drop a copy of that in the chat as well, just so anyone who kind of wants condensed information. It does have the office locations on it. It has the phone numbers. It has a lot of different information about Ccadp. Some of the services that it covers is mentioned in there. So I'll drop that in the chat as well, if that would be helpful. And then I will also drop in some information about the MAUD program and the HCBS program.
Okay. Well, Christina, thank you so much. And Holly, for taking the time out for the presentation. I do see we have some questions coming in. So at this time, we will open the floor up for any questions that may have, and I'll start with what's in the chat. And I believe from Heidi Mazel, Autism Delaware. Can you please share again where an application can be mailed to the three, and I'll see if I can go through the presentation where the three counties, Sussex County social service offices are located.
So we have the one in Newcastle County is the Rockscott building on the 3rd floor. And then we have the Kent County is Milford, and it is the Milford Riverwalk location. And then in Sussex County, it is the Thurman Adams State Service building, and that's in Georgetown.
Okay. I'm gonna just put this up here. Okay. If everyone can see that, Heidi, if you can see that. The next question is having Down syndrome reason enough to be approved for Ccadp? Does Ccadp require to send out re-enrollment forms each year?
So it really depends on, like Holly was saying, as far as the medical level of care each year, financial eligibility is redetermined each year, but the medical piece would be based on whatever level of care was given at the time of application. So like we have some who are reviewed yearly, and then we have some medical level of care that's, like Holly was saying, is good until they age out of the program, or is good for 5 years. So once it goes to our medical review team for review, that's who determines how often we're going to need to review their medical level of care. If they have a chronic disability that's not going to change, and they're going to have that, it might be a disease or a disability or something that they're going to have continually for the rest of their life, then we wouldn't do a medical level of care each year. You know, we wouldn't put that burden on the family. We would just, like Holly said, they would just be eligible medically until they age out of the program.
Okay. And then one of the questions was, how do you determine or how to make sure we have CCADP and not regular Medicaid? So I know some of the families that have come through, one was not aware of CCADP, but also um, they didn't know that they had CCADP or regular Medicaid, or even when do they need to apply. So the question again is how to make sure we have CCADP and not regular Medicaid. Who would they ask, Christina or Holly?
So usually I would say your managed care would be able to tell you what services you're eligible for under whichever Medicaid you're open in or that the child might be open in. Some children may not need CCADP. They could have a disability or some type of, some type of medical need that they're going through, and the services provided under regular Medicaid may be okay and sufficient to meet those needs. But if they're looking to see which program of Medicaid they're open in, I would suggest calling. They should have an office or a phone, a DMMA, our offices, we have caseload still. So depending on which program you're open in, you're assigned to a case manager who is going to kind of manage and do your reviews and all those things. I know at DSS, who has the Magi Medicaid, they don't. It's kind of just open in general. They don't have assignments for case managers anymore. So if it's one of our programs, they'll have a name. Like if you're open in CCADP in Kent County, Holly Reynolds is going to be your case manager, or if you're open, in Sussex County, it's going to be Robin Scarborough. So for us, they should have a case manager if they're open in a Division of Medicaid program.
Thank you. One of the other questions we have here is, can you walk into one of the buildings and pick up an application?
For CCADP, you can. And typically you can pick up the application and the medical packet, those forms that we went over, the whole packet. So if you're at a Division of Medicaid office, they're going to have those readily available. If you go into a DSS office, they may have a CCADP application. They may not have all the medical forms. So that varies. If it's a DMMA office, you're probably pretty good with getting the application and the medical forms. If you're just walking into a DSS office, they're probably going to give you just a general application.
Okay. And we also have another question from Amanda Willis. This process is to get approved for Medicaid based on medical diagnoses, correct? Example, autistic child.
Yes. So, and it could be for anything. I mean, we have children who just are fighting some type of medical physical need. They were diagnosed with cancer. And so the constant, care and the treatment plan and the medical expenses that go along with it. If you have private insurance through your employer and you're getting 20% of that bill, and you're going back and forth, the hospitals are having those procedures. This program can come in and help with that expense for the family, and the child could be eligible for this program. So we do want to look at, what the child needs and be able to, meet the medical level of care, but it could be something that maybe they're going to be over or get through it or work through it or be able to have a surgery or operation and come out of it in a year, 6 months, a year. This program could still be used. It doesn't have to be something that is ongoing, or a physical disability that's ongoing forever. It could be something that, is just that they're facing in childhood.
Okay. And then Amanda Willis, I just know tons of families that think they won't qualify because the parents make too much money. And again, I believe Christina touched base on that, that for the CCADP program, this is based on the need. Am I correct, Christina? It's not looking at the parent's income at all.
Correct.
It's a, go ahead,
Yeah, we're
Christina.
just
Thank you.
looking at the child's income. So, if it's a 6-year-old child and they have no income, or, maybe they have an SSI payment, they're still going to be below our income limit. So we're just looking at the child's income and resources, not the parent.
And I would encourage to Amanda, Miss Willis, is that for the families to encourage them to at least call in to the Medicaid, their care coordinator, and see if they, qualify, because they will be the ones to advise if they can or cannot possibly qualify for the CCADP program. Um, the next question is, can this program work with a child with a mental health crisis?
So this program does work with children who have developmental disabilities. I don't know if that's what you mean. So a lot of times we will partner with, as children are smaller and growing with developmental disabilities, they may be working with us through CCADP as like a co-insurance, and using the services and different things that they need to help support the needs that they're having right then. And then they might also work with the Division for Developmental Disabilities, DDDS. And then as they start to age and maybe want to go to employment and things like that, we kind of transition them into the lifespan waiver. But so developmental disabilities, this program could be used for. I'm not sure if that answers that question. If it's something that you said crisis, so I think it would be based on need, the duration of it, what does that look like? And then just the medical paperwork. I would never discourage anyone from applying though, because I feel like sometimes people don't apply because they do think, oh, I'm not going to be eligible, or we already have insurance, you know what I mean? Or that's for people who are destitute. And so a lot of times people won't apply for our programs, and that is not what our programs at the Division of Medicaid are about. We really want to reach the vulnerable populations and help their families and them through whatever it is that they're growing through, or if it's an elderly person, kind of as they're organizing and meeting those physical needs as they age. So a lot of times we have programs in our programs. It's not just, oh, it looks like I'm over the income limit, or, oh, it looks like, maybe my disability probably isn't as bad as someone else's. We would want them to apply just so we would be able to say, this is why we couldn't get you approved, or this is kind of where we would need you to be. And kind of have those conversations with families, because even if we can't get CCADP open, we might be able to share another resource. You just never know, what could be helpful for families.
Heidi, did that answer your question? And then we have a question also from Ari. Forgive me if I mispronounce your name. Ari Avila. What do parents need to do once child turns 18/19, which is up to 19, I believe the program is for CCADP? What is the process? Does the parent, and I'll just add to this question is, does the parent reach out when they turn 19, or do they get a letter? Does the care coordinator reach out back to the family? How does that process work?
You want me to
Holly,
step
do
in
you
on
wanna
this one?
Yeah, thank you.
So normally what we do at that time is we screen to see if they would be eligible for either SSI Medicaid or adult Medicaid, because at that point it would just be their income again that we would be looking at for eligibility. And if at that point the parent thinks, if they think at that point that they may need long-term care services like the home and community-based services, we would want the parents to reach out for that as well, because that is a separate application process. We can't just automatically see if they're eligible for that.
And I think that would be a
for
good
better.
one for the extra training further down the road.
Yeah.
Who is LTSS and what do they do and who the the key players are for the
Yeah.
parents. Great. Thank you. Do I have, let's see, a few more questions. Would parents, this is again is from Ari Avila, would parents leave the income bracket blank or what do they do with that question on the application?
Do you mean if the parents have income?
Would the parents leave the income bracket blank on the application? I believe that's the question.
So we would just be collecting income information for the child.
It does ask for it on the application, and yes, they can leave it blank or just put a line through it.
Yeah.
And then Heidi said for hospitalization, that's the second piece of the question in regards to for mental health crisis. Can this program work with a child with a mental health crisis? And then Heidi said for hospitalization, sometimes high functioning children end up in mental health situations as it relates to the lack of support in their developmental disability.
Okay. So I will say this is one of those where we would have to review it. Our medical review team as far as what level of care could be given. I will say you have my information. Please feel free, Jennifer, to share it with people. Because there are resources out there that you wouldn't need this type of program is more from, I would want to say, medical or ongoing. So if it's something that might be the cause of not having enough resources or supports in the community, so it has caused something, to occur, and now there's a hospitalization. There are, like I just spoke about, our sister agency, DDDS, who works with children as well, can enroll them with their program if they're eligible. Again, it's usually based just on the child, and they provide those supports that maybe that specific need wasn't being met. They would be able to provide those supports and work with them. So if it's not, if it's something where they're just missing specific supports in order to get to the next level, DDDS may be a better option. If it has turned into an hospitalization and now there's a greater need, CCADP, possibly could do a level of care and get them open, which then would provide that whole services package that has the respite care and all the other services included. So I can't really say yes, they would be eligible because it would really determine what the medical need is, and for our review team to review it. But, feel free to reach out if you need those additional resources for that situation, because trust me, I have been through it with my son, and I know that there aren't a lot of services readily available in those situations. So, I've done digging just in my own personal life, but also, as my job, I have different counterparts and resources at different agencies. So maybe I could help with some of that as well.
Okay, great.
So sorry, I guess I'm gonna jump on camera.
Hi there.
Am I on? I can't tell.
You're on,
No,
Heidi.
you're on. We see you.
So, my thinking was, I just lost my train of thought because I opened the camera. Well, I'm gonna go on to my next question, if I may.
Okay.
I'm sorry, I'm such a pain in the butt. I have a million questions, actually.
No.
So you had mentioned respite, and I think this is really what threw me off. Can you guys possibly put together like a flyer or a one-page informational to share with families how another family member can get registered to be a respite provider? Like, I think this is not necessarily been like smooth as a process, or not necessarily even a family member, but like anybody. I have somebody who will do respite, but I don't know how to get them qualified.
Yeah. So that is really through the managed care is how that happens. And so that's why we don't really have a lot of information on it, because what happens is the managed care organization does their own assessment. So once they select the managed care will do an assessment. There's a case manager on that side of it as well for services. There's an assessment that's done, and the managed care will determine, they need this many hours a day and this many days a week. And, so they will try to manage, like they're going to manage those services and that care. They are the ones that the family member or caregiver or somebody would have to register with and complete. It's a form, like a little packet that they complete, and then the managed care works out how to pay the caregiver. So it occurs on the managed care side, and that might be where a lot of the communication. I know whenever I used to process Medicaid, I would get those calls all the time. Well, my whoever is going to be the caretaker, or the caregiver, but I don't know how to get that started. How are they going to get paid? Unfortunately, that doesn't happen on our side. Once the managed care is selected, they will walk them through that process.
So there's 3 different managed care organizations that are taking care of 3 different providers in 3 different ways. Is that what I'm hearing?
No, they can select whichever managed care is going to be best for their need and supports. So if they choose Highmark, then Highmark would look at everything that they're approved for as far as what program we've approved them for. And then they will do their assessment and work with them on getting whoever the caregiver is going to be. So that kind of happens after we do the eligibility piece. So if they're working with Highmark, it would just be Highmark. They would say, hey, I know I'm eligible for, whatever, respite care or a home health aide, or, whatever they're going to be eligible for, or whatever the need is. And I would like it to be my sister. And so the MCO, whichever one it is, Highmark, Centene, or AmeriHealth, would then get the information so that they can get the packet and get everything completed for that person who's going to be the caregiver. It's almost just like the caregiver is registering with the MCO, because they're going to have to get paid. Usually they get paid through Easter Seals or one of the other organizations, depending on who is contracted with the MCO, but it's just the registration packet for the person who's going to be the caregiver.
And if I may jump in real quick, and I know we're winding down to time for you, Heidi. I have reached out because respite is a big piece that Delaware does not have a lot of resources. So what I've done on my own personal time is reached out to Beach House, Children's Beach House. Is that what it is? I think that's the name. Also, Embrace Delaware. Embrace Delaware is a
Right.
organization that has a camp for our kiddos on the spectrum, and looking to see how they got started, 2, also how can families support each other, because that has taken place years ago. Approximately about 10 years ago, I believe Family Voices tried to start where families take care of each other. I've tapped into Care to Caregivers. That was a training about a month ago where they started in Massachusetts, where it's now really big, where it started with a lady that had to quit her job and needed support, right, for her son on the spectrum. And now it's a big organization that families watch each other's, they do each other's children. And it's really big. It's in different languages, and they use respite funding that for each family. So we could talk talk definitely soon we could get together and talk about it, because it is, as everybody knows on this call, is a significant need for families. We see it every day where families are having to quit their job, especially right around this time here, because nobody will take their children because they have behaviors, or they are sickly with autism, or they just don't have anybody to watch it. We know the home health aide, that there's a shortage. So I know everybody, DMMA, I'm quite sure, the home health aides are, Medicaid is saying, how can we improve this? But yet they still don't have the answer. So definitely would like to touch base with you or anybody that's interested to talk about the, how families can support each other and get paid doing it as they should. So that's still a hot topic. And families are willing, like you said, Heidi, I'm willing to participate in it because I am a mother with a child on a spectrum, and nobody for years wanted to watch. And it's not about me, but I'm just sharing my story. That, and Christina, you may know, and other families that know, Heidi, you know, nobody want to watch children that have behaviors. And with on the autism spectrum, that's one of the things that children go through is have behavior. So, or sickly children that just the parents are just overwhelmed and they need a break. So definitely would like to discuss that, and maybe we can do a presentation on it and have a discussion how we can all come together and help one another. With that being said,
yeah, Jennifer, I'm going to send you information on the Respite Coalition. There's already a coalition in place. We'll connect on that.
Thank you so much. With that being said, help any way I can. Kelly Green, thank you, Kelly. I don't think I have any more questions on the chat. Yes, that would be great. Any other questions before we close out? It's 1:02. I don't see
So I
anything.
know when you close out, Jennifer, I'm still going to go ahead and drop in the CCADP flyer and
Yes,
some of the other
please.
information, and then just get up with me whenever you're ready, and we'll try to schedule something for the LTSS and the MALD program.
Yes,
Okay.
will do. Well, I thank you everyone for coming out and tapping in on our presentation. Christina, thank you so much for that information. It's
Absolutely.
great information. Thank you, Holly, for taking the time out. We thank everyone.
You're welcome.
If Holly, Christina is going to drop that flyer. If you have questions, please reach out. I know you hear this all the time when you come to the MCOs. We do this MCO call the second Tuesday of every month. Next month, we will not be doing, we're going to take a break in July, but we will be starting back up on the second Tuesday of August. Please come if you have any concerns, questions, even comments. Please attend. It's usually about an hour on, like I said, the second Tuesday of every month besides July. We're not doing it in July, from 11 to 12, I believe it is. Please come out. If you have any questions and concerns before that, please give your MCO, your care coordinator, a call. If you're having some concerns about communication, please give me a call, Jennifer Aaron, Parent Information Center, Family to Family. I am here to help. We also have Olga Zapata that now is the project coordinator with the F2F Family Voices, that is also on the team, working with families in regards to your concerns in Medicaid. Olga, I hope you don't mind. I've already put you out there, but we thank you. Thank you everyone for coming out, and enjoy the rest of your afternoon. Thank you so much for attending.
Thanks, Jennifer.
Take care. Thank you, everyone. Bye.
You're gonna send the flyer. Should we wait in the chat, or Jennifer, are you sending it to everybody?
I thought Christina was going to. Holly, if you're still there, can you send that flyer, please? She said, once I got done, I'm waiting to see if she
Oh, I
sent
thought
it.
she was coming back. All right, so if you get it, just forward it to us, I suppose, or at least me.
Okay, so said we can send it to the attendees also. So we have everybody's contact information. We can get that out to you. We will send,
Okay.
and we'll send a survey as well. We'd love to get your feedback on this presentation, everyone. If you could please fill that out, that helps us to know if this is beneficial, if we need to do it again. What was your take on this presentation? Heidi, thank you so much. I'll be in contact with you for sure.
I'm going to send you, I was just going to tell you, I'm going to send you Nancy, well, you know Nancy Rinaldi, right?
I don't.
From Easter Seals.
I probably know her by
yeah,
sending.
I'll send you
Yeah.
her contact information. She's the one who has, oh, there's Christina. She's,
Yes,
I'm gonna send you the, her contact information for the Respite Coalition.
that would be great because I know there's parents that are willing and they really want to, we need help.
You're on the same page. All right,
Yeah.
take
Yep.
care.
Thank you, everyone. Take care. Bye-bye. Amanda Willis. Amanda, I will reach out to you and Kelly Green.